Good morning. It's a real honor and pleasure to be able to speak to you. I also want to thank you very much for the warm welcome that we have received here. I'm really privileged to come and travel here and be able to share with you the work that we're doing at the University of Michigan to address the shortage of pacemakers around the world. We pretty much understand that low and middle income countries have a lot of challenges with communicable diseases. But as a matter of fact, cardiovascular disease is the #1 killer of people worldwide, whether it's in the advanced economies or the third world. Overwhelming majority of deaths due to cardiovascular disease do occur in the low and middle income countries. And it is estimated that about 1 million people in the world die each year because they don't have access to pacemaker therapy. This graph shows the comparison and the gaping disparity between the advanced economies, represented here by the United States, and the low and middle income countries. The number of implants that we perform in the United States is about 750 implants of pacemakers per 1 million of the population. This compares to merely several per million in some other countries. So there have been several organizations that have tried to address this problem, and one of them is Heartbeat International, which in the last 20 years has been able to procure 12,000 devices from device manufacturers and offer them to different Rotary clubs around the world for use for indigent patients who have no access to pacemaker therapy because of the costs. And of course, there are medical missions in which physicians harvest devices from during device upgrades from pacemakers to defibrillators, for example, or after a device infection, and they re-sterilize the devices and they send them on medical missions. What we are trying to address at the University of Michigan is to find a blueprint or create a blueprint for reuse of pacemakers harvested from the deceased. In the United States, there are over 250,000 pacemakers implanted each year. The vast majority of patients who, or a significant portion of patients who receive pacemakers are elderly, and their life expectancy is actually limited. And given that the longevity of devices nowadays is sometimes 10 or 12 years, it is quite possible to harvest devices with sufficient battery life so that they can be re-sterilized and reused in the third world countries. This concept is actually not novel. It was tried in Europe and different other countries. In Sweden, for example, in the early 1990s, 14% of total primary implantations were actually from refurbished devices. But as the prices of pacemakers fell, and the European Union, Sweden joined the European Union, that practice went by the wayside. So what we've done was we've actually started by doing a meta-analysis on studies performed in the last 30 years on this topic. And we have identified 18 studies which examine the safety and efficacy of pacemaker reuse. And we actually found a variety of studies. Most of them have several patients, some of them a few dozen patients. These studies were done in a variety of countries. Actually, one of them is Israel. There's a study by Dr. Cooperman from 1984, which described the experience of reimplantations of 78 pacemakers in patients. And of course, when we compared the risk of infection between the brand new devices and the controls, which were brand new devices, we found that there was no statistically difference in infectious risk. The risk of mechanical malfunction, as you would anticipate, was much higher with reused devices. However, we're starting here with a group of phenomena that are very infrequent. So, pacemaker malfunction of a brand new pacemaker is really a quite unique and unusual occurrence. And so even a 6-fold increase in that risk still appears to be quite acceptable if the alternative is not being able to have a pacemaker at all. So what we did is we performed a survey of both patients and their families at the University of Michigan just to see if this concept was something that would appeal to the general public. And overwhelmingly, both patients and their families were in support of the concept of donating the devices post-mortem to patients in the low and middle income countries. And a large portion of them also were happy to offer the devices back to the device manufacturers, which is what currently is encouraged by the device manufacturers and by the FDA for quality improvement. And then a minority of patients were also willing to donate their devices to veterinarians for implantation in animals like dogs or horses. So we also performed a survey of the funeral homes in the vicinity of Ann Arbor, and we found that patients or the deceased who undergo cremation actually have to have their devices taken out because it is damaging to the crematory equipment. And so in this particular survey, the 10% of devices were extracted prior to burial, and the device was extracted prior to cremation, 35% of those deceased. And so we asked the funeral directors what they did with the pacemakers, and the vast majority of them discarded them or kept them with no intended purpose. And only 4% of them did what they actually are encouraged to do, which is return the devices to the manufacturers. So over the last 3 years, we have actually received over 10,000 devices. 15% of them are of adequate battery life, which we define as at least 4 years of battery life remaining. These numbers on this graph actually come from a paper that we published a year ago. At this point, we had performed an analysis and we were trying to quantify the number of pacemakers that we were receiving that actually had the 4 years of battery life left on them. And for pacemakers, that number was 15%. It was a little bit higher for defibrillators because they have batteries that are larger. And by ventricular ICDs, 1 out of 3 biventricular ICDs that we receive actually have at least 4 years of battery life left in them. Of the devices with adequate battery life, average time from initial implantation was about 2 years. And so to summarize, the meta-analysis of the prior studies supports the concept of pacemaker reuse. We have verified that the general public and patients and funeral home directors support the concept. And we also know that 1 out of 5 devices that we get, which is a combination of pacemakers and defibrillators, has at least 75% of the original battery life left or 4 years left. So what we envision is a partnership between the funeral homes, between legal teams, a funeral home, a funeral director association, and centers of excellence like University of Michigan or others who would engage in a process of reclaiming devices, evaluation of the devices, and re-sterilization, and then passing them on to nonprofit charitable organizations, which would then identify centers in the low and middle income countries where these devices would be suitable. And of course, all of this has to be done with the oversight of the Food and Drug Administration. We are currently at the point of planning a prospective clinical trial on 400 patients across the world, and we are negotiating with the FDA about getting an export certificate to allow us the clinical trial. And so our hope is that we can create a blueprint for device acquisition, sterilization, and reimplantation. We will continue to raise public awareness and scale up the model so that we can have a self-sustaining nonprofit organization that will allow patients with no access to pacemaker therapy currently to receive this treatment. I want to thank the collaborators that I've worked with, and Dr. Tamir Bauman, who actually was one of my fellows who has come up with this brilliant idea, and I have sort of taken over managing this project after he left. And I certainly work with a lot of collaborators who, without whom this really wouldn't be possible. And so thank you for your attention.